The Business of Hospice, Part 5. Hey y'all, I'm Shelly. I do tips for hospice nurses and hospice leaders, and I'm doing a series on the business of hospice so that we as clinicians can learn to speak the language that is meaningful to our financial leaders so that we can help influence and shift the cost burden onto wasteful processes and not frontline care. So what I'm talking about today, kind of simple to understand, but we have to practice it to get it into our daily, what we do every day. And that is capturing all of the secondary and comorbid conditions with our patients. I already did a video on how we get the best hospice diagnosis, but it's very important that we capture as many secondary conditions and comorbid conditions as we possibly can. We're even seeing with Amity's audit division where clients that are getting audited are getting denied because there were no secondary or comorbids, or only like one or two. So this is becoming very significant. This helps to give a good image of how debilitated the patient is. But sometimes as hospice nurses, when we're admitting a patient, we struggle with this. We don't always have a great past medical history on our patients. And we are pushed to hurry up and admit patients before we can get a thorough past medical history. So one thing that I do though is I look at the medications, and every medication is going to have a diagnosis attached to it. So if they're on high blood pressure medicine, I ask them, do you have a history of high blood pressure? Were you diagnosed with that? Yes. So hypertension is a diagnosis. Any medication that they're on is going to have a diagnosis attached to it. So that's one really good way to build your initial list when you first admit the patient. And then while you're waiting to get the rest of the past medical history, take the time to dig back into it really well and capture everything that you can. And also talk to the patient and the caregiver, because they will also, in the course of telling you the patient's whole medical history, they will tell you stuff that you don't find always in the past medical history, in the records that we have anyway. So I hope this tip was helpful, and stay tuned for the rest of my series on the business of hospice, and you guys be safe out there. And now remember, I love you guys.